But of course, peptic ulcer, they affect two parts na the body, inside the digestive system, wey na the duodenum or the stomach. But doctor dey with we here today for explain to we better let we know wetin na peptic ulcer disease, let we know if types dem dey, let we know wetin are the signs and symptoms, wetin dey cause am, then how e go mend, wetin are the medicine dem, whose medicine dey waka together, or whose medicine not dey waka together, or whose eat dey wey you no for eat at all wey you get this kind condition. So stay with we. Remember say the number you go call or you go send you message na 079 900 907 or 077 315 147. Doctor.
Yeah, Sister Giffy, thank you for this short introduction about peptic ulcer. Family, peptic ulcer disease na a disease condition wherein you get affected na the GI tract, along the GI tract. What do we mean by GI tract? From your mouth right down to the anus. Now that area then the way peptic ulcer it affect. And what do you mean by ulcer? Ulcer na a sore where they any part along this tract, what would call them the road from your mouth to the anus. But when we talk about peptic ulcer, specifically with a limiter around the stomach and the duodenum. In fact, based on that, I make that they divide peptic ulcer into two broad categories, the types. One, we get the duodenal ulcer, where in the affect the first part of the duodenum. You know, the one that we will do anatomy small. You know, the duodenum, now after the stomach, before you go to the small intestine, you know, that short distance from there to the small intestine, you get what we call the duodenum. And that first part, that between the stomach and that of the small intestine, that first part, now we call, where any sore, we commodity, now they call duodenal ulcer. Then we get gastric ulcer. Gastric ulcer, specifically, they affect the stomach part. And how it really come about? You know, inside the stomach, let's talk about like the gastric ulcer now. Inside the stomach, or right down to the duodenum, we get thick lining membrane where it protects you from gastric. You know, the stomach get a lot of gastric acid, hydrochloric acid, where it secretes. Because in fact, I them help we most times where it even food where get them boku bacteria, it help for kill them. Then it get immune functions, but then they will go left out for another discussion. But basically, it get acid inside your stomach. So any part of them inside the stomach, if you get gastric ulcer, the acid they go there. If by any means that lining where they protect the stomach, it wear out or it gets sore, you get ulcer that would call gastric ulcer. Where it go down to the duodenum, also it get that lining there, the mucosa lining there, where they protect the inner parts of that duodenum. If sore can back, it cause duodenal ulcer. Now sore did it. So we get series of things where they cause this peptic ulcer disease. You know, we don't talk say the peptic ulcer divided into two. We get the gastric and we get the duodenal ulcer. Then two years and then form gastric ulcer. We get also other ulcers there, but then they will go left out for other time. You get even esophageal ulcer. Then make I tell you say from the mouth to go, you esophagus. You get ulcer, leg ulcer. You get intestinal ulcers. They want it all, but then they not really count for now. We count for peptic ulcer where it affect mostly people then now this country and now the world. Then we get basic statistics. Let us just wave out this one quickly. Normally in the world, they estimate say this is a recent research. They estimate say 4 million people worldwide annually. Then they come down with peptic ulcer. 4 million people. Then in Africa, when we come down to Africa, we say we did. Then tell we say 1 in every 1,000 person they suffer from peptic ulcer, and this is a very recent research outcome as early as this July, where it don't pass 2022. That every one person in Africa out of 1,000 it get peptic ulcer disease. Then of course death. The death depends on what they lead to the death. We get mostly death they result from, yes, some people go say peptic ulcer they kill. Depending if you left and take it reach certain stage, we get the perforated ulcers. So the prevalence of that is 10 to 14 in men percent. They die out of peptic ulcer. If we get like 10 people we get peptic ulcer, there is high chances that 10% to 14% they die out of that. Women then get up to that. Of course, the prevalence now is between 10 to 14% for men. So it's like men they get more ulcer than women. Maybe as we go along, you will see why. Because sometimes even the lifestyle of men might be. Then also women is between 8 to 11%. So generally, in fact, they look at and say, on average, every man or woman almost they apart. Because 11 to 14%, then 8 to 11% for women. Even though women they on the low side a bit, but then they still get out. So everybody liable for get peptic ulcer, you know. So normally for duodenal ulcer, waiting at the how normally we can call how long, how many years you go take where you go get them. Then tell we say peptic ulcer. Almost everybody prone to run. You not get age limit. Peptic ulcer not get age limit. But duodenal ulcer between 30 to 50 years, people then are prone to more duodenal ulcer. So I don't know if family will understand that. When we talk about ulcer, we get two types. One, we get gastric ulcer, then we get duodenal ulcer. The gastric ulcer, in age limit, it can affect any age. But like duodenal ulcer, they don't tell you, say, mostly it affects older people from 30 to 50 years and more. Now then one day it affects. So I can stop here so far.
So you can stop there so far. Fumble, if you just they join with this now Wel Bodi Tok program where they come to you live from Radio Maria Salon, the Christian voice. Now you host. You they get we na FM 90.9 na Freetown. Now we fought for studio 10 outreach na Freetown. 90.7 na Kenema, 91.7 na Bo, and 101.3 inside Makeni. Me, we the host the program, na Gifty Masakoy, and me special guest, na Dr. Samuel Bello. Yeah. And what will they talk about today? We they ask the question: are you a peptic ulcer disease patient? If yes, then note this. It don't start for tell we waiting at this. When I say the peptic ulcer, not a one no more they talk about now two where the types you get the one way now the belly, the hamburg, you get the one way now the first part of the small intestine in the hamburg as they don't tell we the duodenum. And also go and tell we say all over the world 4 million people this thing they hamburg them every year. But for we inside Africa, of which Salon are part of, out of any 1,000, one person must get this problem. Same way don't tell we say again 10 to 14% of this condition a common per man them. And also for the duodenal, the ulcer where they hamburg one part man the small intestine, when at the first part the duodenum, they say studies don't show say it more common in people that wait on the age 30 to 50 years, whereas the other one it can hamburg any age. Yeah. So we go one know as time they go waiting they cause this problem. Why we get more man them where this thing they hamburg than woman them. We go one know waiting now the signal, the signs and symptoms where somebody go no say now this not the problem. Okay. Because the sick then can always fever, but you get waiting they make difference depending. Okay. So doctor don't take it to go. Not forget say the phone lines they open. You can take notes, you can call, you can send you voice message or you text message, or you can even send message you a view on Facebook. All important for help for the program for go before 079 900 907 or 077 315 147. Yes, doctor, for let we go know now, you don't tell me the statistics, you don't tell me waiting at peptic ulcer, you don't tell me waiting at the types them. We're going to know waiting they cause this peptic ulcer disease. The way they hamburg the belly, and the one where they hamburg the first part and the small intestine.
Yeah, good. The causes of peptic ulcer, generally, now two basic causes of peptic ulcer. But we get other one the way that they come in as we go along the discussion and they tell you that. But basically, when you even read books and others, then they basically stress on those two. One, we get a bacteria, what we call Helicobacter pylori. Now, a gram-negative organism, bacteria, formerly they will be called Campylobacter bacteria. And this bacteria now one of the causes of peptic ulcer. And let me hasten for say this, that statistics don't prove, research don't prove, say, almost 90 to 100% of all gastric ulcers are caused by Helicobacter pylori, this bacteria.
90%?
Yes, 90%. They between, of course, for duodenal ulcer, they say 60 to 100%. So generally, we can take between 60 to 90% of both duodenal and gastric ulcer is caused by Helicobacter pylori. H. pylori, yes. We call it in short H. pylori. It's a gram-negative, or called the microbiologist then will tell you say a gram-negative bacteria, aerophilic, and all the rest. Again, your characters. But that is the key cause of the organism where they cause peptic ulcer. Then the other thing where it lead to peptic ulcer is the use of NSAIDs. What are NSAIDs? The non-steroidal anti-inflammatory agents. The continuous use of it or frequent use of these NSAIDs. What are these non-steroidal anti-inflammatory agents? Like then painkiller then. Like then they talk about more basically aspirin and that of ibuprofen. We call brufen, you get diclofenac, you get mefenamic acid, Ponstan, you get a lot. I can call many of them. But basically, then non-steroidal anti-inflammatory, we get naproxen, then one then they. If you take them continuously, monotonously, without any precaution, with your doctor in advice, and they tell you, say, you are prone to peptic ulcer. What did they do? Then they wear out that mucosa lining, now the GI tract. Thereby, when they don't remove that mucosa lining from the GI tract, it will lead to ulceration there. So as a result, when acid body, now it begin feel that pain. That's one of the signs of stomach pain. Then you can even feel indigestion. That's another sign, indigestion. Always, you better fill up with breeze. You get that regurgitation. Sometimes they even eat food, make like it come back to your throat. Because you don't get proper digestion, indigestion. It can lead to that. Those are the initial signs of peptic ulcer. You can also get mostly when you can get bleeding also is another sign, because sometimes when you don't take perforation don't take place, you know they take any medication, or even if they take medication, it is still continue for use, then you the conditions the way that they aggravate the peptic ulcer, it lead to perforation. So bleeding, then one and then the cause. But when we come to complication, you see them. Some actually, when I was not part of a medical team, some people may say peptic ulcer, now hungry the causer. But with all me reading now medical school, with me own personal research where they do, they don't tell me outrightly food really abstinence not the cause peptic ulcer. What food causes, some food then they aggravate peptic ulcer. If you already develop peptic ulcer, you take that food then it worsen them. So most times again, now the kind type of food, but not to purely hungry. So what did they don't prove? Now then two basic. Then also stress. Normally we get stress ulcers. Then most people the doctors they can diagnose them when they find out say somebody stress they can develop stress ulcers. So that's another cause. But basically now then two key things in the cause, the non-steroidal anti-inflammatory agents, continuous monotonous use of it without control, it can lead to that. Then also Helicobacter pylori. When we come to the treatment, you find out say, why then treatment? And some people can ask why when they put I get ulcer, but they go give me antibiotics. But failing to realize that there is a very key cause of peptic ulcer when the bacteria when H. pylori.
The bacteria na H. pylori, the shortcuts, and a gram-negative organism where they cause them. Yeah. And another cause na we don't use for take some painkillers. Yes. And some of them painkillers, get aspirin, panam. Because at times some people can get some pain. Yes. In one get they take the same
4 or 5.
Now the name different, but now the same work the medicine. The one go take buffet, it take diclofenac, it take Panadol, it take aspirin. So all they do the same work, they do more harm than good.
Yeah.
So the classification, then different medicines they are, then fall under this NSAIDs. So if you they take her, then na problem. The diclofenac, the naproxen, the bufen, the Ponstan, the aspirin,
the naproxen.
Yeah. So you therefore be very, very mindful because most people they feel say na where you fast or where you angry too much, where you take some kind food go make the belly hurt and all. Then at times even with the peptic ulcer, I should say the type the way if you angry.
Yeah,
you get the pain. You get the one now where you eat.
Yes.
Now you get the pain.
Fine. Yes. Normally, the stomach ulcer, that is the gastric ulcer, you find out say when they actually pain you only when you eat, because when you eat that moment what we call the churning process of the stomach. They mix the food. So when they mix that food, if you get sore on that stomach, believe you me, once that because as you eat, acid they pour. Now, I mean, one of the way would they even get for prevent the drugs that will get for key for treatment of peptic ulcer. Or kill any bacteria that come. So you get straight away they get pain because acid don't go there and you get also already. Now, I mean mostly gastric ulcer. The one that when they get gastric ulcer, when they eat at that time they begin feel the pain. For the duodenal ulcer, that when they don't get food, they don't eat. So when they don't eat, still acid they inside the stomach.
The duodenal.
But the duodenal, they get the stomach, the stomach. So when the acid they run, they go to the duodenum. Empty acid, you don't get food, you don't neutralize it, they pass through the duodenum, so you feel that pain back once if the sore in at the duodenum. So mostly when you are hungry, duodenal ulcers, when they are the one that when they get duodenal ulcer, when you're hungry, then they feel the pain because then get duodenal ulcer. Acid don't reach whose side you're not supposed to reach. But when they get gastric ulcer, now that one of the way that the doctors and they differentiate if this is duodenal ulcer or gastric ulcer. Now, I mean, when they go there, they ask you, wait, it's not that in the heart or where the way angry. So now that means, well, some people can misunderstand and say the hungry because the peptic ulcer, but not to that really that they try for. Then they try for see how they can able to diagnose them very well and give the particular treatment. What would they count down to the treatment? They see if not duodenal ulcer, how did they handle that? If not peptic ulcer, how did they handle that?
So if na duodenal ulcer or na peptic ulcer, if you na peptic ulcer disease patients, you don't take note of the signs and symptoms. That's one key thing na pain. It can be pain before you eat or pain after you eat. It depends usai disorder.
Disorder, exactly.
Because ulcer na sore. But when they talk about sore, we take place na the belly or na the first part na the small intestine. So either you get pain before or pain after. It depends outside the sore take place where the acid day. And at times if you say where you eat food and I go aggravate the type of eats them or the type of medicines them, what will they take? Then any other thing that they way like they aggravate if somebody already gets this peptic ulcer disease. Any other thing the way they aggravate the pain apart from the NSAIDs or apart from the H. pylori, the bacteria, where they cause them. Any other thing they like as to be specific about food. Yes. Something like if the person already know say he get the condition where they go cause more problem or the food self they go add in your own day. Okay,
yeah. So food then they will just wave out down quickly because of time. The type of if you get peptic ulcer or you get a duodenal or peptic ulcer in general, it is gastric or duodenal. For fashion coffee, coffee is one way they aggravate the pain of the peptic ulcer. It is worse now. Then also chocolate.
So the coffee can be the black coffee.
Any type of
and
coffee.
And the Nescafe.
All those
because
ones. Yes.
Most people now know more of Nescafe.
Yeah, coffee generally. Coffee you get some coffee where you not get caffeine.
Okay.
They are now producing it.
Okay.
But even if you not get caffeine, for the fact that it is coffee, it's
So they're on the safe
contraindicated.
side.
Yes, it is contraindicated in peptic ulcer patient. You don't need for take out for long. If even you dey take out, make sure you eat enough food with the count to that day. Then also you get chocolate. Not fashion chocolate too much. But you know say chocolate, now what? You get caffeine there somehow. You know, you get that caffeine tendency. Then also spicy food, of course. That is very common around anybody will get ulcer. As they tell her, they will say, hey, I know they eat pepper again, I know they eat this. So something was very spicy. Then soft drinks that will get too much gas. You know, you get for avoid that. Because waiting peptic ulcer sometimes it do, it generate, you know, that acid where they pour inside the stomach, it release a lot of gas. And that gas, it even sometimes make your stomach look bloated, mostly in gastric ulcer. So you find out that most people where they get peptic ulcer disease, they are always either they get too much bloated, they can get indigestion frequently, then also they can always get gas in their stomach, full up, always the same belly, look choke up. Then sometimes they belch frequently. You know, belching is one of the classical signs that peptic ulcer almost indigestion as well as peptic ulcer. Then you pass out wind frequently, foul. It foul frequently. So always breathe inside your stomach. So always with the advice, say you forget about spicy food. Then of course our good old friend alcohol. Yes, alcohol you for moderate or even limit them totally or avoid them. Then acidic foods. You know, we get different types of food where you get acid inside. We may not know, but I can just call few, like then citrus, orange, lemon, then one then get acid inside it. So anything where food will get acid, you for avoid that. Then of course, tomatoes. These are all food where you for totally avoid. Caffeine. You know, I've been telling you that initially, caffeine and coffee, you get caffeine inside coffee. But now that they make some coffee where you don't get caffeine. Because some people that they react to caffeine. So, but even neither of the two, advisable for peptic ulcer patient. For take caffeine or any medicine where you get caffeine. So that is the reason why, in fact, most of the non-steroidal anti-inflammatory agents, some of them, they are combinations and getting caffeine product Then one thing where we for really avoid overeating. Somebody will get peptic ulcer. You not for overeat, you better not for full up too much. Then overeating, then also for eat some more 2 to 3 hours, you go to bed because it create indigestion. So the advice is always eat early. It left like 3 to 4 or 5 hours before you go to bed. So most times you can advise before, if you normally they go to bed around 9 o'clock, 6 o'clock latest, you don't eat done. You don't for eat any heavy diet again where you go overload your belly. That's one thing. You avoid overeating. Then also eat early before you go to bed to avoid that reflux. Because I don't tell you when I say reflux, that means the food they come back, they try for come back na the mouth. Then they digest very well. Then they feel a lot of gas bloated within it. So it cause a lot of cramping and other things overnight. If then they attack you as a peptic ulcer, you don't go sleep all night. Then one thing again as a peptic ulcer, protein food, red meat and others, if you really like when you go in a crowd, don't avoid eating it too late at night. Because also then they release enzyme called pepsin. And pepsin is one of the triggering hormone for release of hydrochloric acid. So more of it when you take it aggravate the higher secretion of hydrochloric acid in the stomach, and hence if you have ulcer, it aggravate the pain. So that is it. And it also causes indigestion overnight. That's it.
That is it. Peptic ulcer disease patient, note this. So if you don't miss any part of the program, you get an opportunity for may you go listen and back. And we repeat broadcast we go come on Wednesday, 7 o'clock, even 10. But you don't join we, continue for stay with we talk today about peptic ulcer, a condition we don't about plenty people. And one from the statistics there we say between ages 30 to 50 years. So it is more for young people until you go to adult to the aged and all. So we need for take note, if you don't dey feel pain, you na person wey don dey feel pain where you eat, or where you angry you dey feel pain, then you need for go for more explanation, for go see doctor, for make dem tell you better, make dem rule out some of them thing there, or let you even able for explain more wetin are the other signs, the other complaints the way you get, so dem go able for rule am out. If you dey get pain after you don eat, or pain before you eat, or you na person wey don dey pandemic medicine there so for long term now, or you na person wey don use to coffee wey get caffeine, if you no take am, you no go able do no work for the day, because some person can say you no able do no work if you no take coffee wey get caffeine for keep her awake, or you take energy drink there wey get dentin and they all, or you no get time for it, especially when you don pass 40 now, okay, so you don pass 40 years and all, digestion self get your own time, very slow and all. So if you say you eat any hour, then you get for pay the price.
Exactly.
So we get all that in there. So you don't tell me say 1 out of any 1,000 African they suffer from peptic ulcer disease, which means it can either hamburg the stomach or it can hamburg the duodenum. And it don't very serious, because at times it can lead to, if the medical treatment fail, pass get for end up to surgery. So we get for that day. That the voice of Dr. Samuel Bello. We don't take you through this first half of this program. We will go for a short break. Stay with we. We'll be joining you very, very soon.
This is a disease where ulcers develop in areas of the gastrointestinal tract or the digestive tract, which are in high contact with the acidic gastric juice. So if you don't know what an ulcer is, it's a lesion which kind of looks like a crater. I'm going to put a picture of it here. So when a person has a peptic ulcer, it can result in bleeding. This bleeding, it can lead to a type of anemia. There are 3 common causes of a peptic ulcer. The first is a bacteria called Helicobacter pylori, and this is the most common cause of peptic ulcer disease. So this bacteria has several adhesion proteins, so it can attach itself onto the gastric cells of the stomach. It has an enzyme called urease, which breaks down urea into ammonia and carbon dioxide. The ammonia produced helps to protect the bacteria from acidity of the stomach, and it also damages the protective mucus layer of the stomach and the gastric cells. It also produces an enzyme called catalase, which protects the bacteria from phagocytosis by the neutrophils. So to summarize, the Helicobacter pylori is basically damaging the lining of the stomach, causing these ulcerations, which is why the complications of peptic ulcer disease occur. The second cause of peptic ulcer disease is excessive hydrochloric acid secretion. Now, higher concentrations and higher volume of hydrochloric acid can occur in diseases like Zollinger-Ellison syndrome, and it damages the protective lining of the stomach. And this excessive amount of hydrochloric acid can damage the protective lining of the stomach and gastric cells, because the amount of acid is more than what the body can resist. The third cause is non-steroidal anti-inflammatory drugs like aspirin. Studies show that these drugs irritate the lining of the stomach. They impair the barrier properties of the mucosa, and they increase suppression of anti-inflammatory gastric prostaglandins. They reduce gastric mucosal blood flow, which also affects the defense and repair of the lining of the stomach. So those are the 3 main causes of peptic ulcer disease. Now we're going to talk about how it's treated. So in terms of the treatment of peptic ulcer disease, if the cause is due to Helicobacter pylori, antibiotics are usually the first line of treatment. Additionally, reducing the intake of non-steroidal anti-inflammatory drugs is also recommended. Oral antacids are usually a temporary form of treatment because they buffer the gastric acid. If we have hypersecretion of hydrochloric acid, we can use H2 blocker medication or proton pump inhibitors like omeprazole, which block the secretion of hydrogen ions from the parietal cells of the stomach. Additionally, there are some therapeutic options like reducing alcohol and caffeine intake and reducing cigarette smoking. These are recommended because these habits can impair the mucosal defensive mechanisms.
Hey everyone, this lesson is on the signs and symptoms of peptic ulcer disease. So we're going to talk about the common, less common, and more rare signs and symptoms that occur in peptic ulcer disease, and we're going to talk about why they occur. If you want more information on peptic ulcer disease in general, please check my lesson on that topic. But before we get into the signs and symptoms of peptic ulcer disease, what is peptic ulcer disease? It is a disease of focal defects or discontinuation, which really means an ulceration of the gastrointestinal mucosa. So the lining of the stomach and the lining of the duodenum, which is the first part of the small intestine. So here's your stomach and here is the duodenum, and you can have ulcerations occurring in the stomach and the duodenum, the first part of the small intestine, and you can also have them in the esophagus as well, but we're not going to talk about those as much here. So again, the stomach and or duodenum may be affected if the
Humble, welcome back to the second half of a program, Wel Bodi Tok, where they come to you live from Radio Maria Salon, the Christian voice. Now you all send you, they get we live now we 4th floor studio, 10 outreach na Freetown. And you they get we live na FM 90.9, inside Kenema na 90.7, Bo na 91.7, and Makeni na 101.3. Inside today on topic, we ask the question, if you na peptic ulcer disease patient, if yes, note this. So inside the first half, we don't talk waiting a peptic ulcer disease, we don't talk the types them, and waiting at the causes, they waiting at the statistics. So now we go to the diagnosis, how we they know. We don't begin to come if you get some amount of pain before you eat or after you eat, or you not person where don't they take any of their NSAIDs them, if they take aspirin, if they take bufen, if they take diclofenac, you don't take them for long, and you don't they feel some of them pain there. So before you eat or after you eat, it will be a cause for concern. So we go and know how we they diagnose this, normally from the history taking and also from lab investigations. Sure. Because we don't say one of Iyonki tumbu, as I go say, Iyonki tumbu na the H. pylori when a gram-negative bacteria. We will not see with we eye pass with the help of the microscope. So we go and know how we they diagnose peptic ulcer for let we know if na the duodenum in the hamburg or if na the stomach in the hamburg. Then how we they treat them? Now which treatments then normally can be available, or whose other type of management there for this kind of case? Because we don't see say for some of the causes there, some of the things then can be lifestyle.
Yeah,
lifestyle modification. Because if you know somebody we get for they take caffeine all the time, they tell you say they are at risk, and all of them here. So then how drug interaction they take place, whose medicine go work for the Wel Bodi take place, or whose medicine where if you join them together they do you more harm than good. We get all land inside the second half of this program for you with Dr. Samuel Bello.
Yeah, okay, sister. So family, we don't come again. We'll briefly go through waiting at the diagnosis, then treatments, then some of the things where you know for do, then also the drug interaction. If they give you the medicine, how you go take them so that it will work very well. So we'll start with the diagnosis. Normally, peptic ulcer diagnosis, as sister don't say, it's first of all based on clinical signs and symptoms. The doctor then, anyway, go then they ask you boku questions, they tell them. So they go first, they go diagnose them clinically. But for confirm, most times they can go ask you for go do tests in the lab. Then they get a test where then they do for that tumbude, what we call Helicobacter pylori. You know, the gram-negative bacteria. They can even do culture and sensitivity. They go test for it. Then they get even other way the laboratorians they go tell you. Then also they get another way what we call the bear on me test. Bear on me test, doctors then go request and they go able to show. They also even scan, then they able to do them. Then know say yes, this is the peptic ulcer, and who side locate, who side not locate, then go do all that. The MR scan, all that thing, and they show how they diagnose peptic ulcer. Then how you they treat peptic ulcer? You know, peptic ulcer treatment based on the cause of the peptic ulcer. If na NSAIDs, what would they like? What we don't talk say first na NSAIDs. NSAIDs are non-steroidal anti-inflammatory agents like the ibuprofen, the Ponstan, the naproxen, what we don't call, or aspirin. One of the things is Then goes either you stop taking the NSAIDs immediately. Your doctor go advise you say, if you dey take aspirin, if you dey take any drug for pain, either you left am totally, or it go tell you how you go reduce that, because situations then they were in, the person not go able to go totally sister without that pain medicine.
Oh, yeah.
Let's talk about the arthritis patient. If the arthritis patient, you got arthritis at the same time, peptic ulcer, it'll be difficult, very technical for managing that kind of person, because you know they go without the pain medicine, because otherwise you just be beating a dead horse, because the other pain the more than pass, even the peptic ulcer. So you can forget the non-steroidal anti-inflammatory agents. But even some non-steroidal anti-inflammatory agents, they're very good. Once you go to doctor, it will tell you, say, okay, this one, if one someday now, like would they celebrates, then they know the cause, they're not contraindicated in peptic ulcer. It will mark them for you. But sometimes they're very expensive and it's difficult for see. But if the one that is very common around, it can either tell you how you taper the dose or how you administer it. So then most times they tell you, say, take her, reduce the dose, then you take her with food. You take her with food. That's one. But if you don't get arthritis, so the best advice is you either for stop, for take, then painkiller them frequently. Then two, you get for switch to another medicine. Because if you see say that particular one, like I don't tell you, say you get ulcer, but you don't go able to go without pain medicine. You get other pain medicine, you can able to take a like if you get stomach pain, most times now you can find out say cocodamol is very common when they mark out for peptic ulcer patient, because they fall among that non-steroidal anti-inflammatory drug. But even though it can do some or Panadol, it can do some analgesic effect, even though it don't get anti-inflammatory effects based on. But the doctors then go know, or you go to a very good pharmacist, they're able to tell you, a diagnose them very well, it show you the difference. Yeah. Then also the other way for stop, the other treatment is we get what we call proton pump inhibitors. They call them PPIs, the proton pump inhibitors. You know, in a system, in the stomach, we get what we call a pump the way it open, then through the hydrochloric acid they pour inside the stomach. So that pump there, we get drugs the way, because anytime hydrochloric acid pour in the stomach, even if one saw there, it cause serious pain. It even worse in the pain, because outside acid they go to sore. Could you imagine? You know, when that lining been there, it protect them. When it come, they meet the naked cells them. But once that lining don't wear out, it don't create sore there. When it cannot, it destroy more the cells then. Once the mucosa lining don't wear out as a result of the sore. So, for let it not create more damage to the cells and others, they give proton pump inhibitor. That proton pump inhibitor, it reduce the amount of hydrochloric acid that is secreted in the stomach. And some of the examples of those proton pump inhibitors we can normally call omeprazole. It's done a very common around for ulcer patients. Omeprazole, esomeprazole, lansoprazole, pantoprazole. Those are all the drugs, labiprazole. Those are the proton pump inhibitors. Then we also get another drug, what would they call histamine receptor blockers. We get histamine receptor blocker 2. Then histamine receptor blockers, then are chemicals in the body that signals to the stomach to produce acid. You know, histamines, then they signal to the body, say, produce more acid. We need more acid, especially when the time need for acid. But that histamine, if for let you stop them, for let you not signal to the body, say, I want more acid, then they call a receptor blocker, histamine receptor blocker. Then they block them. We get 2 types, histamine receptor blocker 1, blocker 2. But when you go into more pharmacology, then they tell you that. But the one more we use is histamine receptor blocker 2. Yes. And that one and now example of them are cimetidine, which is very common around Tagamet. You get Tagamet, Famotidine, Ranitidine, when as Zantac, mostly common. In fact, the one way common more than Salo, I know now that we get the Tagamet and the Zantac, when Ranitidine. You know, the generic name is Ranitidine, then of course the trade name is Zantac. The same like cimetidine, the generic name is cimetidine, then the trade name is Tagamet. Yes. So that one and those are the histamine receptor blocker 2. Then we get also the protectants. What do you mean by these protectants? Then they coat the ulcer. Then the protector against the acid. As I don't tell you now, anytime acid go, now that's all the outside that's all the it cause more harm, it cause more pain. So when you give that protectant, it go it protect, it serve as a fence or protective, it cover the whole side that saw there, so that it go protect her from whenever acid come out, it not go directly to, it not go meet the sore directly, so that it not go feel that pain. That will cause actually protectant. Example of that way, it's difficult for see sometimes around.
Okay.
Yes, but the sucrafit. Mostly doctors take mark as sucrafit. When I was, most times you go to pharmacies where they or even I was in the hospitals, sometimes when doctor mark, sometimes it's very difficult for get, but sucrafit is very good, and protectant. Then, if still there is still, like I don't tell you, say, you get patient, definitely there is no way they can stop them totally from NSAIDs. So the best way, administer together with misoprostol. We get what we call misoprostol. Well, the women know it. That's why again sometimes it's one of the reasons why misoprostol was really approved by Pharmacy Board of Sierra Leone. It get different uses. Would they use that even in peptic ulcer treatment? Would they use that also as postpartum hemorrhage? They want it. So misoprostol, and then not just impossible they use misoprostol. Oh, this not all. But most times they use that for also if somebody get arthritis, then they can normally combine that non-steroidal anti-inflammatory with misoprostol. Misoprostol it help for produce more mucus for cover that what is them. So when it takes NSAIDs with meal, or you normally I don't tell you today. Sometimes if the arthritis patient, the doctor can advise say, okay, take them in low dose with meal or lowest effective dose. If not like 500 milligrams, if the 200 milligrams, the doctor go say, well, they take them. Maybe you go reduce the dosage interval, because for let it not cause that, or it reduce the milligram. And mostly, even if the aged person, you go reduce that further, for may not create more harm. So also, it tell you say, if you stop smoking, either you quit smoking totally, and also you stop alcohol intake, because alcohol also it aggravates peptic ulcer.
So no clarifier, because you get plenty go ask that question.
Yes.
With the issue of alcohol,
Yeah.
where then for stop. Which one preferably would they talk about? Because I'm going to say, take little for thy stomach's sake. Then we don't get an emphasis where there are certainty, if at all, you know, there's no way for the still just get for go by, and when it comes like with the aspirin and you NSAIDs, or you waiting, you get for still ensure say you eat very well before you take that medicine. So whereas where you go get somebody we go still like you say, if I eat very well, they are take me medicine, I not go drink. And if you for drink, limit it, because the alcohol then get in percentages. You get the one that we can take the whiskey, the very hard one at the bottle then, whereas you get the 5%, then beer them and all, but you get all that way go then 30-something%. So which one more?
Mostly alcohol, they are all I can take them. They are all drugs.
Okay.
So it depends on the dosage, how high you get. So me go advise you for avoid that really alcohol use. But if by any means there is a situation where you cannot avoid, then limit the quantity. Then also, like what we don't advise, eat very well, not take on empty stomach. Then try for make sure say you not take at that high quantity or the high percentage of alcohol.
Because as you just say with the ordinary ulcer, we more common from age 30 to 50.
Yeah, 50.
And we find out saying at that age then get more social life.
Exactly.
More exposed to social functions like the Sundays, the weekends, from Friday right through Sunday, tomorrow na holiday, and get for enjoy, sometimes again party and all. Then sometimes not even think safe for it. Some person where you wake first in the morning in tea and everything wrong. So, especially them pega pack, then gin them and all. So it's like as they say, lifestyle gets a greater role for places. Like we get for emphasize on lifestyle. Yes, the drinking, the smoking. We really get for emphasize the late eating and more by the age where you don't reach. And all that time for they take note of some of them signs and symptoms. Not wait stay it was then before you they go. Then also doctor we I don't see who some man say he get ulcer. I think say in preferred drug always where you see go take that new gel. The suspension, mostly some can take the new gel or any of them when are antacids. We then prefer for take am. We need for tell public make they understand which drugs them for be taken before food with peptic ulcer, then which drugs for be taken after food, then which drug and which drug they interact, and which drug and which drug they not they meet up.
Fine. Doctor, sister, this is very important and very, very, I would appeal to listeners, may them pay keen attention to this. Because you can get all your money, you get all your drugs, doctors they prescribe, diagnose very well, prescribe very good medicines for you. If the way how you take her, you not take her the correct way, it will not work. It will not work. Then this is wherein a lot of people they say, oh, they're messy and they're not better. Now substandard. Then they're messy, doctor, their doctor not good. What you don't prescribe for me, they work safe. But failing to realize that, they take her the correct way. And most times again, with colleagues, sometimes, the workload so high, they don't have that patience to really educate you time, how you go take them messy, which one first, which one second, which one not taken together. Time not day. Because if you meet like one doctor, you got about 30 or 40 patients for C, can waste all in blade time on you. That is the reason why, in fact, most times the pharmacists are the ones that are supposed to be educating people on these things. But most times, again, you go there, most times the doctor, one grade a day, they prescribe, they explain. So most times they don't get enough time really for educate the patient on how they will use the medicine correctly without any drug interaction. Because most of them drugs, are 2, 3, 4 drugs together, they must interact. They must. Then they are the assure. So, but the way how you take them, it will help you born more. So, like when you don't talk, normally what they come to the therapy type, and they tell you say we have triple therapy. In fact, now we don't treat ulcer with monotherapy. They take like how no more you don't say first. Some people they only get antacid, now no more than they take. Then they will not help you. The moment no more they help you, antacid, what they help you, that moment they now temporary relief no more they give you the pain, but they cure the ulcer. These are the tell you if no more they take, the cure. That way you get the pain, that moment they take her, it calm you down for a while. But after which it will call back. So now that antacid in they do. So in one grain they able work. So now make normally in the treatment of ulcer, we get monotherapy, we get quadruple therapy, we get even sequential therapy. Those are the 3 types of therapy. But we'll come there. So like if most times the triple therapy, then they give you the proton pump inhibitor, we don't talk about the omeprazole. Then you can give a histamine, H2 blockers, whether the cimetidine, lansoprazole, ranitidine. They will give you omeprazole. Then also they will give you an antibiotic. Because in fact, any ulcer treatment, 90 to 95% of all ulcer prescriptions now should have that antibiotics in it. And most of the antibiotics, sometimes some people will tell you about clarithromycin, will come to see. Sometimes they will tell you about amoxicillin, metronidazole, tetracycline, depending on the situation. So antibiotics must be there. Then also, last but not the least, you can normally get the antacid. Either you can prescribe normally the antacid, what would they call like the gelocil, the antacid, what we can call magnesium hydroxide or magnesium sulfate. Then we get antacid like new gel. We get different types, new gel, old new gel. These mostly me working, I can advise patients when they want to buy new gel. Maybe it depends on the situation. If they get a lot of gas inside you, and most times also they come with those gas. So you go buy new gel where you get what we call cimetidine. Cimetidine are anti-flatulent agent where they inside the suspension. It help you for reduce pull more gas, reduce the bloatiness. Then also it help for reduce that pain. So if you forget cimetidine, always look for on the bottle the components they did it. Cimetidine that one of the where they inside the new gel that it help for anti-flatulent agents. Then you get also some antacid suspensions. They don't get down the Malox and others. They don't get down the that for just for the pain that moment they for relieve that pain. So that. But when you they take, if you get like antibiotics, you get the antibiotics. Let's say amoxicillin, they don't prescribe her, or metronidazole or clarithromycin, any one of it, they don't prescribe her for you. You get antacid, then you get omeprazole, you get proton pump inhibitor most times. So mostly, some doctors they use the omeprazole when at the proton pump inhibitor, then use the antibiotics, then also then use the antacid triple therapy. Well, how you they take her? If all the three then you take them together with that antacid, the antibiotics, and even the omeprazole, they work. They are two not they work. If you take them at the same time, then like what's now, there were three I take them, I put them in water, send what happened. Then two drugs they work. Why? Omeprazole, like a prodrug. When it reach the stomach, what do we mean by prodrug? It not be active until it be converted. And what are the converter in the active form, like the acid? So even though acid that would try for prevent for let don't they at the stomach for let it cause more harm, but the omeprazole when get for go stop that proton pump for let acid not pour more inside the stomach, it needs some acid for be converted from improved drug form.
So is it why
to
it's
active
preferred
form.
to be taken before breakfast?
Yeah, we're fine. That is it. So omeprazole, they take her with antacid. The omeprazole.
When I take note because
Yes.
let you not waste the money for buying meds.
Medicine
Take all
together.
together. One get power passing comping.
Yes.
One go inhibit. It
The
go stop.
action
It go
of the
slow
other
the
one.
action of the
Not
other.
even
That's like
stop-
na waste.
It even stop them because like omeprazole, now a prodrug, it will only become active for doing work when acid don't convert them from the prodrug form to active form. So before it begin act. So if acid not because antacid what they do, they go neutralize the acid. So the effect of omeprazole will be zero. So the drug will just remain as prodrug. Then you pull them back. So it not go work. Then also the antibiotic. Antacid always that any like amoxicillin and any the other antibiotic, they kill it with them. They combine together antacid and like amoxicillin, then they form what they call a chelation. Then they come together, they form one bond. So they prevent the action of that amoxicillin. So at the end of the day, then two drugs that always don't take, maybe that the pain no more, it will relieve at that moment. But the bacteria where amoxicillin or clarithromycin for kill, that bacteria, the amoxicillin or not going to kill that bacteria because it already don't inactivate them. Then the omeprazole, that acid, high acid secretion, where it's supposed to stop, if I close that pump, they able because it's still there in the prodrug form, they in the active form. So at the end of the day, you're going to take that drugs 3, 4, 5 months, you see no improvement. You go to begin to oxidate drug, always they can't add, now fake drugs there. But knowing that the administration was very poor, nobody educated you very well. So those are some of the things you get to be very careful about. When you take any drug, what are the advice? Take patient, you ask the doctor, how I go take this? And they take this and this together or this one. So mostly where they advise people then is that when you get them 3 drugs in, you go take the omeprazole and the amoxicillin maybe 1 hour before you take the antacid, either Gelosi or
Nugel or Malox.
Yes. Or at least give 30 minutes interval. If not the Malox and the Gelosi first you take, left them one there first. After 30 minutes to 1 hour, you take them. You take the other one there, but not take them all together because most of them drugs they take 30 to 45 minutes for let it be totally dissolved, assimilated, and go into the bloodstream. So before you bring it out 1 hour, they don't already do their action. They don't go. The acid already cold your belly. Then when you bring in all the acid and but most likely advise they drink the omeprazole and the amoxicillin first. When the acid don't act
Everybody
on it
acts best.
yeah, then they act, yes.
An empty
They
stomach.
need acid. Before now, they take the omeprazole where they go neutralize the acid, they belly cool. So by then, maybe when the amoxicillin and this or clarithromycin go into the bloodstream, now they kill a lot of bacteria because it's active. So that is how normally we do the administration. Then one and the particularly ulcer patient, then take antacid together with most of the. In fact, not peptic ulcer. No, most times antacid, they go with boku other medicine there, even with other sickness within other sickness there. If you're an ulcer patient, you now again how they call her you get other disease condition where you need for take antibiotic. Please not take antibiotic together with antacid. You know the work. The antibiotic not the work. So far, now that's tentatively I go stop. Then we will count out to, or we can go to triple therapy.
Triple, just go because
okay, briefly, time. Yes.
Time is
so
up.
Triple therapy normally. Now, like I don't begin explain that. The three drugs that they put together will not they treat ulcer now with one drug. Like how people then when you get I get ulcer, then just they go give you or take Gelocin or take omeprazole in one. You know they help you in any way. We get 3 drugs. Mostly you get forget antibiotic day, you get forget antacid day, then you get forget either proton pump inhibitor or you get histamine receptor blocker, when are like Tagamet and others. Then you get also quadruple therapy. That thing in our quadruple means 4. You can give 4 of that because you can get like 2 most antibiotics together. Like in that case, you can give proton pump inhibitor. You give bismuth. We get what we call peptobismuth. You can hear it most times like you prescribe peptic ulcer drugs. Peptobismuth is difficult for C, but you can also then tell that they coat the surface of the mucosal lining. Then also they give antibiotics. Mostly when you give peptobismuth, you give proton pump inhibitor. Mostly the antibiotics where they follow either tetracycline or metronidazole. So sometimes they see doctors, then they interchange their drugs. Yeah, you go begin wonder why. I been give me this, but depending on the kind diagnosis we don't do. And mostly then drugs here you for take out within 14 days. Normally anyone then give you know for go below 14 days, at least 2 weeks the treatment. Then also sequential also it depends on sequential can be proton pump inhibitor. You add clarithromycin, then you also add tinidazole. Tinidazole and another big brother, or it's the same group with metronidazole. These are the macro. They what?
So that's the voice of Dr. Samuel Baylor for take we through. If you na peptic ulcer disease patients, I believe say you don't take note of everything. That peptic ulcer disease, now they go to one medicine. Again, class of drugs the way they go with. And strong advice now that you need to take all together because one go stop the other one in work. So now waste you go waste time. So if you be done they go over the counter, just they go buy Gelocin, you they buy new gel, it's at the same group of drugs.
Yeah.
Or you just they eat any tranga eats them or sour eats there, they eat go on soup, all of them thing. I make you say they put fire on top fire or they
exactly.
add petrol to fire. So you already get acid na the belly there, you they go add more problem there. So you they make the wound or the sore way for well. Like where you wound the well, you go grease them back, you go scratch back, then the wound fresh back. Now that na the thing. So if you they go through peptic ulcer, remember say you for they eat small but frequently. When you work at least you go get biscuits na your bag, you go get half eat them because you know say you not get for the angry quick. You get for eat small but frequently. You know waste that one go eat like how other person go eat that one go boku eat there you begin get the pain they suffer. So if you get any of them problem here as doctor don't say go and see your doctor or you don't they take any of them meds here and they see improvement. It be say you not be done they take them correctly the right time or the right dose. So go meet doctor. May he explain to you better, let you understand how for manage this ulcer problem, either na the gastric or na the duodenal. So with the telephone now, doctor go say bye bye, and we go wrap up the program.
Yeah, okay, Fambu then. You know, time don't really catch you, but briefly, like just see, you know, most of them drugs that way they take, you get some side effects, and then side effects I call it briefly. If you see down there at the advice, say, go see your doctor one day. Like if it is too much feel nausea. Like you want for vomit, where they take them medicine there. Go see explain to your doctor, he go give you medicine where you go handle that day. Then utter sense of taste. If you taste the change, some of them medicine where they take, it make you they feel you taste the change. So tell your doctor, medicine and they way go counteract them thing and they dark in stool. If you go stool, you see and I'll say you too or your tongue, it don't become dark. You also get for tell the doctor, diarrhea, headache, temporary reddening of the skin. That one and some of them drugs I don't call it can lead to that. So as you tell the doctor, I go no say, oh now this let find a remedy, they can handle that. So Fambu then we'll get more for talk about this. Yeah, but time don't catch we. We'll go find time again for come and discuss more. In fact, the type of food where you for take, like for example, you get for the take probiotics, you get pear, apple, cauliflower, you get blueberry, the berries, blue raps, blackberries, all very important for handle you if you get ulcer. Carrots is very in Spanish. Olive oil or other plant-based oils. And honey also very good. Garlic, then turmeric. Basically, na my last word.
Basically, na last word and the time now always say do for we who have to tell viewers and listeners and plenty. Thank you. Me na give Masakwe wake up with the program to you today. Well, Bodi Tok and for tell thank you to Abdul and in team, the technical people them we don't help we for bring this program come live on Facebook and on air na Radio Maria Salon. Thank you to Dr. Samuel Bello. Tete next week. Forget say. This na the month of October, the rosary for Biwi Padi. And let me not forget for call on Mama Mary. See you next week na new thing for the mass. And by God in power, we go join on back na the radio. We left now in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Are you depressed, worried, rejected, or tormented? Always tune to Radio Maria Sierra Leone, Christian Voice in your home on FM 90.9 in Freetown, 90.7 in Kenema, 91.7 in Bo, and 101.3 in Makeni for the best.